Good morning and welcome to the Wavy Digital Desk. I'm your host, Sarah Good, and we're going to be here today with CHKD. We're being joined by Dr. Anisha Garg, who's a child and adolescent psychologist, and we're going to be speaking about bullying in our Back to School series today. So we're going to be hearing from her, about her practice and answering some questions about, bullying going into this year. I know that cyberbullying, physical bullying, mental abuse, there's so many different ways that we can address this and take a look at it. So we're going to bring Dr. Garg on to have this conversation today. Hi, Dr. Garg. Thank you so much for joining me today.
Hi, thank you for having me.
Absolutely. I think going into the school year, this is a parent's concern on either side, whether their kid is going to be bullied or maybe they are going to be the bully. And I think it's something that has resonated for years. I don't know about you, but it seems more complicated now in the line of the internet and cyberbullying and everything that is potentially going on. But just to get started, can you just tell us a little bit about your practice and your experience with this?
Yes, of course. Like you said, my name is Dr. Anisha Garg. I'm a board certified child and adolescent psychiatrist, and I work here at CHKD. We offer a wide range of services here, ranging from outpatient to intensive outpatient to partial hospitalization, and more recently, inpatient since last fall. My role as a provider, I work both in the outpatient setting and as a consultation liaison physician. So, meaning that I work in the main hospital for kiddos who are admitted for any kind of medical concerns. If they have some kind of comorbidity, such as anxiety, depression, we're able to kind of provide those services and therapeutic needs, if any, or assess for safety concerns.
And, in your practice, I'm sure you see a range of cases, but, are you seeing what people might think of as, more typical bullying to, more extreme cases? What are you seeing with kids right now?
So yeah, we see a wide range of bullying. I think when people think of traditional bullying, they think of more physical or verbal, so hitting, name calling. But what we've been seeing more on the rise, especially with COVID, is cyberbullying. So lots of bullying that's happening through social media, through the use of our cell phones, texting, or online forums. And that's definitely a question we get a lot from our parents as far as how to manage these things.
And what types of, bullying are you all looking at? Is there a range? Are there certain kinds that you all treat in a different way individually?
So we definitely see a wide range of bullying, and as far as the approach to it, there's definitely different approaches. So for things like physical and verbal bullying, those are things more likely happening in a common area, so school settings. So we're definitely talking to parents, to teachers, to educators, to school administration as far as how can we address these behaviors, especially if it's impacting the child's mental health. The other aspect is outside of school, so more commonly cyberbullying. So that's when we're really having those conversations with parents and the kiddos themselves as far as how can we practice safe internet use, how can we be managing these things so that it's not impacting our day-to-day lives.
And in terms of, when people come to you, are there certain best practices that you all offer to people, at least as a start, in terms of how to handle bullying?
Yeah, I feel like the most important thing is just open communication. So, a lot of times when they're coming to us, we're discussing this at length and kind of figuring out what's going on and how this is impacting them and what's our supports in place. So, whether it's a friend that we're talking to, our parents, or school staff, making sure that there's that open line of communication between us because it's really going to be the supports from the people around us to make that change happen.
And if you're a child that maybe is less communicative, especially with your parents, are there certain signs that parents might be able to look out for? And maybe they might point toward, a variety of emotions. I don't know if that's depression or what, but, are there certain things that parents can keep an eye on?
Oh yes, and I think it's kind of hard to gauge this too because around adolescents, teenagers, it's kind of normal to be not as conversational with our parents and kind of keeping more to ourselves, and we tend to gravitate more towards our friend circle. So kind of gauging like when is this typical and when is this now becoming concerning? And our biggest kind of red flag is if you're seeing any changes in their mood or behavior. So if they were once like really outgoing and socializing and now they're kind of tending to stay in their room more, not wanting to go out, if you see any changes as far as their eating patterns, eating more, eating less, or sleeping patterns, sleeping more, sleeping less, not wanting to get out of bed, those types of things, that's when you want to get more involved and have that communication with your child.
And I know as a parent, you want your child to be resilient. You want them to be able to sort of move through challenges in their life. But when does that line perhaps get crossed? When is that something that maybe you need to step in or maybe you need to seek out help for your child?
It's a really great question, and that's one that we get asked all the time. Like, what can we do as parents? So, definitely advocating for your child, but also encouraging them to advocate for themselves. So, that you use that word resilience. So, it can vary amongst our kiddos. I mean, definitely our children are a lot more resilient. And so, trying to educate them as far as what's okay, speaking up for themselves. And then, when do parents really step in? It's more of like, is this really impacting our child to the point where now they're coming to us and seeking help? So if a child is coming to you and letting you know, like, hey, I need some help or I need to talk to someone, really stepping in and getting those resources, speaking to our providers and trying to get them connected. The other aspect is if we're concerned about safety. So now if they're demonstrating changes in their mood or behavior, that's really warranting that, my goodness, I need to do something about this to keep my child safe, then definitely reaching out again to our resources and providers to get them that safety care that they need.
And I think people might be concerned about, seeking additional help from primary care or a psychiatrist, once it crosses a certain threshold. But is it something where, you could, as a parent, take your kid in the earlier stages of perhaps when they're being bullied, and that's just as helpful? You don't need it to reach an extreme.
Mhm. Yeah, I think with ongoing conversations and a lots of awareness when it comes to mental health has really helped kind of destigmatize mental health overall. And I think that's kind of the first step. I know that I've done a lot of work with working in the school setting and just having those conversations, and it's amazing how many more kids are able to kind of speak up when that conversation is open. And so I think that's kind of the biggest thing is just kind of making sure that we're addressing it earlier on before it does escalate to a concern where it's impacting us to a severity level.
And that's interesting. I think we've been having conversations about technology frequently here at Wavy, and we're going to continue those conversations, but it's sort of in every facet of life now. And so it's interesting, you talk about to earlier, like having internet safety and sort of learning some of these tips to sort of, I guess, reduce your risk or just figure out ways to sort of help your child. But if it's a situation that, maybe isn't physically in school, so who the perpetrator is, who the group is, if it's sort of a phantom bully or somebody online and maybe the school can't really help, I mean, are there certain instances where, you sort of need to limit your child's access potentially to social media and to the internet? Are there instances where you sort of need to sort of protect your child and sort of take them out of those situations?
Yeah, that's a really tough question. I mean, when it comes to internet use, I think it's around 95, 96% of our children are using internet in some way or capacity. And so it's often needed for things like school and communication. So there's a lot of positive and negatives when it comes to social media use, especially. So as far as positives, the use of social media is a way to connect with others. And that's something that we saw a lot with COVID when we're able to meet with others in group settings, that this is the way that we were able to stay connected with our peers. But along with that, there comes a lot of negatives, and that's also with social media use. And so that could lead to some, verbal or even like emotional types of abuse where we're feeling left out, we're feeling that need to get lots of likes on Instagram posts. And then if we're not getting those likes, where it's kind of uh, making us kind of question ourselves, what's wrong with us that we didn't get as many likes on that picture? Was there something they didn't like about us? And that can really in turn affect our self-esteem and how we feel about ourselves and lead to things like depression, anxiety, and even suicide. So I always have that conversation with families as far as, I don't know if we can really say cutting out social media is the way to go, because we're going to have these exposures, but really setting limits when it comes to social media exposure. So setting limits as far as our screen time being aware of what our kiddos are doing online. So lots of open communication. I always encourage parents to become friends with their kiddos on social media, whether it's Instagram or Facebook. I guess Facebook's a little outdated now, but just kind of making sure that they're seeing that space that they're utilizing and seeing the things that they're posting. And if there's things that they have concerns about, they can always have those conversations with with their children. But I think again, it's kind of just being more mindful of what's going on online and just having that open door of communication with their children.
And you talk about self esteem. And I think with that, some bullying feels very personal and very targeted. It can be about your personal appearance, your personality. In those situations, are there tips that kids can use to sort of help grow their confidence and grow their self esteem, even maybe if these negative, forces are sort of coming at them?
Yeah, so and it's a tough time, right? We're going through adolescence, teenagerhood, and that's the time when we're doing a lot of self-exploration. So kind of learning about our identity, exploring our sexuality, our gender. And so there is a lot of times where we're a little bit more critical of ourselves. So I think it's kind of building that self-esteem by doing the things that we love. So encouraging them to do things like activities that they enjoy doing, spending time with positive influences around them. So spending time with their peers and having those conversations as far as if you do see comments that are affecting us or comments that are negative about ourselves, how do we respond to those types of comments? How do we take that? Do we tend to take that more in and try to say like, oh, this is really focused on something about my appearance or something that I wore? Or is it more of like, no, that doesn't really bother me, or they don't know what they're talking about, or kind of ignoring the fact? So kind of gauging how a child responds or emotionally responds to certain comments can always help kind of guide that.
And have you ever been in this situation, just going to the opposite, so not the victim, but perhaps the perpetrator or the bully? What do you do in those instances, or what can parents do on that side of it if their child is the one bullying somebody else?
Sarah, I'm so glad that you brought this up because I think there's a lot of negative connotations kind of targeting towards the bully, but oftentimes the bully is often experiencing their own mental health concerns, whether it's their own issues with self-esteem, depression, anxiety, concerns in regards to their social environment, their home environment, and that can often lead to things like bullying to make themselves feel better about themselves. So I think it's also really important for parents to continue to speak with their children if that's the concern. What's driving that behavior and what's causing that? Why do we feel the need to bully others? Is it because we're trying to fit in with certain people? Is it because we feel less of ourselves in other settings? So this is the way to kind of make up for it. Because there's always reasons behind things. So trying to really understand what's going on there and how we can better support those children too.
And I think some parents might experience shame or they might be embarrassed of their child if they're the ones being the perpetrator. But, really what you just said, they really should not view it as that, but seek help for their child.
Mhm. Exactly. It should not be something that's shameful. And I think that goes both ways as far as being the bully or the victim. It can be perceived that way from the parents or even from the children, and they might not be willing to speak up, but really advocating for those children and saying this is not something shameful, but something probably more underlying that's driving it, and kind of figuring out what's going on here and how we can best support our kiddos and how we can best support the parents as well and how to manage these types of situations.
And last year, the CDC came out with that teen mental health study, and there was a lot of news about it and just how sort of dire the situation looked in terms of how depressed certain kids are, bullying that they're experiencing. So it seems more that this is, sort of a public health sort of issue too that sort of goes across the board. I mean, are there things that you all are looking at or keeping an eye on in terms of how many people are, having bullying or having depression right now and the link between those things? I mean, what are you all seeing in the field?
Oh, yeah, definitely. I mean, we've seen lots of escalation when it comes to mental health. I mean, we were in the state of emergency for a mental health crisis in our children population with the onset of COVID. And so it just makes us more aware that the needs that are needed across the country as far as providing those supports. I mean, even as recently as over 10 years ago, it was suicide was the third leading cause of death. in the age from 10 to 24-year-olds, and now it's the second leading cause of death in our children. So we're definitely seeing that escalation in mental health, but that also just gives us more reason to address these things. And I think that's another positive that's come out of it, is that it's a conversation that's now being had that wasn't being had 20 years ago. So people coming into the school systems and having mental health conversations with specialists and providers, with teachers and parents and students themselves, it's so refreshing to hear that, oh, we had a mental health day, that we talked about this during a fair, and it was a way for kids to kind of speak out a little bit more. So I think there's been a lot of positives to come out of it, as far as seeing the need and trying to have more of those conversations, those dialogues that are happening between different people. I think there's also a lot of room for improvement. We can see that there's still lots of needs as far as getting mental health services in place. So whether that's therapy, whether that's psychiatry for medications, there's definitely still a big need there, and there's definitely a gap that needs to be addressed. So it's trying to address these things earlier on before they do tend to increase or escalate over time to more of those safety risks like suicide and suicide attempts. Mm-hmm.
With that, I mean, going into this school year, are there certain sort of action steps that parents can take with their kids to sort of educate them on bullying before they start a school, whether they're starting the same school or a new school? I think especially getting into middle school and high school, the dynamics are just ever changing. And so is there anything that, parents can sort of let their kids know what's okay, what's not okay, what to do to get help? I mean, is there anything that you sort of share in that vein?
Oh, yeah, definitely. And as you mentioned, bullying does tend to increase amongst the middle schoolers. And so that's really where we're seeing a lot of those changes happening. And as far as getting the parents involved of what they can do, I love using the word education. So just a lot of educational awareness, kind of sitting down with your kids and identifying what bullying is. I feel that there's still this misconception that bullying is just the physical or the verbal, and they don't really see the subtle ones, like the social or emotional type of bullying that can happen that's a little bit more subtle. Another way to kind of term it is relational bullying. So that's kind of like the mean girl kind of scenario, where they're feeling more isolated or they're not included in certain activities, and that could be a form of bullying. So just trying to educate our children as far as what that looks like, and then as at the end of the day, it's advocating for ourselves. So how can we speak up and say something about it when it's not okay? So letting our parents know, letting our teachers know. Every school requires, for the state of Virginia, part of their code of conduct is to have anti-bullying harassment codes. So really trying to make sure that we're notifying school, the administration, the staff, so they can also intervene. We're intervening earlier, it helps escalate the situation.
And
Or
what you
prevent
just,
that.
oh, sorry to cut you off. Just to ask, you just said something about, standing up for yourself or speaking up for yourself can also just mean, talking to a teacher, talking to a parent. So I think, people hear the word stand up for yourself, and whether it's a group or whether it's a difficult situation, not all kids have either the voice or maybe the safety to stand up for themselves in the hallway. But, taking an action step to tell a parent, tell an adult, tell a teacher, I mean, that is within that power of yours, to tell someone.
Yeah, and really validating that as well. So when a kiddo is able to speak up, really like praise that effort and acknowledging how much courage it takes. It's really hard to speak up when you're in those settings, because there's always that fear of being retaliated on, or that fear of being made fun of. If you were able to tattletale, as someone were to say, or to tell on someone that something's happening. And we really want to empower our children that it's okay to speak up, and that this type of behavior is not okay for us to manage. And so it's okay to say something, whether it's to that person or speaking to a friend or a trusted adult, so that we can make that change happen. Because we want to make sure that we feel safe in school, and that our kids feel safe with going to school and being amongst their peers.
And in terms of how you might, treat some of these cases or speak to some of the patients, is there anything new that you all are doing or interesting? I don't know if that's regards to, a different kind of maybe art therapy or getting a hobby. I mean, is there anything that you all are sort of either doing or looking into right now?
So, I mean, there's definitely lots of modes of kind of intervention. So you mentioned a few of them. It's kind of gauging as far as where they're at. So definitely the first kind of thing is always encouraging open communication and doing the things that we love to help kind of build how we feel about ourselves, build that self-esteem, build that confidence. So doing activities, sports, whatever we feel like is helpful for us. And then if we feel like we need to do other modes of communication, so there are things like journaling or doing art as a way to kind of express ourselves. I always encourage parents and children to express themselves in artistic ways if we have struggles with communicating using words, and that's not something we are innate with as far as emotional language. So sometimes it does require different modes of communication. And if we're needing even more intervention, so seeking out like counseling or a therapist, there's different types of therapy and kind of finding what works for you. So there's your traditional talk therapy, and under that, there's different levels of therapy. We also mentioned art therapy, there's music therapy, recreational therapy. So there's different levels of therapy as well, kind of figuring out what works best for you and your child. And then, of course, there's always concerns if, we're trying these therapies and we're not really seeing that progress or there's some barriers there, then we can also assess if a medication can be of value and trying to address the mental health needs, whether it's depression, anxiety, in that sort of realm.
Right. So, I mean, I guess in that way, parents shouldn't feel, I guess, denial or, upset if perhaps, maybe the first line of intervention doesn't work. There's so many options to sort of figure out what's the best way to get your child to be as healthy as possible.
Yes, definitely. And a lot of studies show it's actually like a combination of all of those things above that can be most successful in kind of helping your child. So I definitely don't think it's one that fits for everyone. It's kind of finding what works best for you, but it could be a combination of those things. And we always encourage children to do the things that they enjoy, kind of finding their niche as far as kids that they can relate more things on. A lot of times in school settings, they feel like they're different from their peers. And so it's really hard for them to find common interest or to have that peer group. And so they tend to turn to online communities. So as far as like being interested in like video gaming or whether it's like anime, they tend to find that peer group. So kind of finding their sense of belonging that have similar interests and kind of foraging something like that so they can feel like they have something positive in their lives and lots of encouragement and support from their social circle.
Well, Dr. Garg, thank you so much. I don't know if there's anything else that, in your training and in your education that you like to share with either kids or parents. I know that as a child and an adolescent psychiatrist, you work one on one, right, with kids. And so, I mean, is there anything that you address directly to them, whether it's a visit, just telling them, encouragement or anything that you sort of send off with them?
Oh yeah, and I know this is something that I've continuously have kind of talked about throughout this conversation, but I think it's so important is having that open communication. So I love working with kiddos one on one, and it's amazing how much more they're willing to share with me than they are with their parents. And so it's also really important to have those open conversations as far as what's going on in their lives and what are we feeling as far as our mood, our if we're experiencing any worries about things, sadness about things, and how we are best addressing that and making them aware of their support system. So they have these people that they can turn to. Who are your support people? Who do you feel most comfortable with as far as having those conversations with, whether that's a peer, family member, or me as a provider? And sometimes that can happen. And so my role is to really make sure that we're presenting this in a safe space and making sure that open communication is still happening with the parent so that we can address any needs that may come up.
Absolutely. So, I mean, I think that's interesting. It doesn't necessarily have to be your parent. I think parents hope for open communication, but finding a trusted friend or adult that can sort of help you through it.
Definitely.
Well, thank you so much, Doctor. I don't know if there's anything else that you sort of want to mention as we head into this school year, but I've really appreciated your time today, and I think you've given a lot of good, tips and advice for both sides of the situation. So hopefully, if anyone's struggling, they'll be able to at least either reach out, but know what kinds of interventions exist, and not to be shamed of it, but to reach out for help for this.
Yes, I think that's the most important thing you can gather is that The thing to do is not be ashamed of this, that this is something that's happening, but how can we best support them and seek out help? Utilize your resources, going to your pediatrician, your primary care provider, and expressing your concerns so that we can really get ourselves connected and make sure our kids can just thrive and be successful in the school year.
Absolutely. Well, thank you so much again for your time. And if anyone's tuning in right now or they're watching this conversation later, it will also be available on wavy.com for you all to look, to get connected with CHKD's lists of resources on the topic and find out more. So thank you so much, Dr. Garg, for your time. And thank you, everyone, for tuning in this morning.
Thank you for having me.